Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. In the studio today, Dr. Wesley Shankland of Lima Dental Associates.
Good morning, George.
Good morning to you, sir. And why? No, you asked what? Why?
Why would you ask?
We got a bunch of things we're going to do about why.
Well, we're going to do a series of 4 shows on why. And why would I suggest a crown?
Okay, why?
Crowns, crowns are sometimes called caps by people, but we have all kinds of crowns. A crown, just think of a crown as something that we put on to protect a fractured tooth or a broken tooth.
Mm-hmm.
And sometimes we have a large filling in a tooth, we'll bite on a pecan or chew some ice or something, and we'll break the tooth. The tooth, if it can be restored, generally requires a crown or a cap to go over top of the tooth to save the tooth. We want to save the tooth if we can the rest of the person's life.
Right.
But so if they have a large filling, they can break a tooth. If they get hit in the mouth with a baseball or just any way, they can break a tooth off. And we have some pictures of some teeth that have been restored that were broken and then restored with nice looking crowns. If a person has a root canal, the crown is somewhat fragile. The tooth is fragile, so it needs a crown on top of it.
That will work.
It'll work well. If you have an implant, you have to put a crown on top of the implant to restore the occlusion of the bite. And so anytime somebody has a problem with a tooth like that, if we can place a crown on that tooth, and we use a simple crown, can be a stainless steel crown, especially for kids' teeth. We can use gold crowns, which are wonderful. We can use all kinds of porcelain, which are very aesthetically pleasing. Mm-hmm. They almost look like the Lord himself created them. They look so nice.
It's like the actual tooth.
Looks just like the natural tooth, and many times you can't even tell. And that's what we try to do. The dentists at Lima Dental Associates, I don't do crowns there, but my colleagues that do, they make these teeth look as if you can't even tell. If you smiled, if you saw somebody in public, you would not even know that they have a crown. It's not their natural tooth. So we can build up broken teeth, root canal treated teeth, implants, fractured teeth due to trauma or motor vehicle accidents, things like that. And we can cover and protect that tooth for the remainder of the person's lifetime, generally, a nice crown.
So in other words, a crown is pretty useful just for a lot of things.
A crown is very useful, and especially for people who want to maintain their teeth as well as they can.
Okay. Any final words for us?
My final words are keep smiling, keep sharing, and keep caring.
Okay. And especially with a crown.
Especially with a crown.
Okay. Good note there. Thank you very much.
Thank you, George.
That's our report for today for Lima Dental Associates and Dr. Wesley Shankland.